everyone. How are you going today? Are you all pumped for a Sunday? Are you all pumped for a Sunday? All right, cool. I mean, the Twitter stream was louder than you guys the first time around. Okay, well, what am I talking about today? E-health update from Asia. And because I'm on the last day, I get to use a couple of cool pictures of Larry in here. So Dr. Chu said in his opening address that our job at Medicine X is to imagine what the future of healthcare and medicine can be. He said, we're here to start a conversation and how we might work together. And I'm sure you're all in complete agreement that that's exactly what's happening here. And like many of you here at Medicine X and tuning in on the Global Access stream, I've pretty much dedicated my life to the improvement of health outcomes through the use of technology and information in healthcare. And it's an absolute privilege to be able to do so. As my Twitter profile says, it says I'm the CEO of the Health Informatics Society of Australia. And what HISA does is we're all about advocating, supporting and fostering the digital health ecosystem through health informatics in Australia. And yes, I do have the coolest job. It's true. Okay, what is health informatics? Well, there's many definitions, and I don't really want to get hung up on definitions, but for those of you who haven't heard of health informatics before, and in the States you term it medical informatics, but it's pretty much the same thing. It's basically an interdisciplinary field that studies and pursues the effective uses of health information to improve health outcomes. And what year is it? It's 2014, almost 2015. And how does healthcare do this right now, mostly? By and large, we manage the information of healthcare on paper. We don't use computer technology. I thought this was a great picture, and my friend Dave Dembo lent me this. I'm not sure where he got it, so thanks, Dave. But that's how patients feel, and we're in this siloed system where they're looked at as a mixture of body parts, not in a holistic manner at all. And how do we manage their information as clinicians in healthcare? Well, we're working in an industry that still considers pages and faxes as being cutting-edge technology, where in any other industry, you need one of these things, a TARDIS, in any other industry to see pages and faxes as being the most technologically advanced system that we have. But that's how healthcare works. So back to health informatics. Health informatics people, they specialise in the use of technology to manage information in healthcare. They're a very broad group. A lot of us, myself included, have clinical backgrounds. I actually trained as an occupational therapist. There are a lot of doctors. There are a lot of clinicians in health informatics. There's also a lot of IT people. There's people that have health information backgrounds. And what binds us all together, despite our differences, is our absolute desperate passion for improving health outcomes, improving the lives of patients, improving the quality of care that they receive, and improving the lives of clinicians so that they can do their job better through the use of health informatics. And it's pretty cool to be able to do that. We have a broad skill set, and for those geeks in the audience, and I'm in Silicon Valley, so there's probably not many of you here, but for those geeks in the audience, there's a babblefish there. And I like to think of health informaticians as being the babblefish of healthcare IT, because we speak the clinical language and we also speak the IT language, and we can be that bridge that brings them together. So why is health informatics important? Why do I do what I do? Because to err is human. This is really embarrassing, but I'm putting it up here because it's a true story. Happened just a week or two ago. This is a hospital in Victoria, where I'm from, that accidentally wrote to 200 GPs telling them that the GPs, I don't know how many GPs, but basically there was a wrong click on a computer system, and instead of sending out 200 discharge notices, they sent out 200 death notices. Yep, live feed. So the reason why that's important, even though that's really embarrassing, mistakes happen. People are human beings, we make mistakes. We also make mistakes when we design systems and we don't think things through. How is this even possible that a poor human being who's probably, I hope they're probably in all sorts of trouble now and they're certainly embarrassed, did this? I mean, it went up right to the Minister. The Minister of Health got questioned on what happened here. And just one click of a mouse and we've notified that 200 people are dead. And they're not. Which is a good thing, of course. But as you guys know, there is a problem with safety in healthcare, and unfortunately we harm and we kill a lot of people. It's a horrible fact. I don't know why it's not in the newspaper headlines every single day, but it's true. And this is actually a real plane crash. And how many of you, show of hands, are getting on a plane today or tomorrow, sometime soon? It's quite a few of us, right? Now, don't panic. I don't want to cause this sort of, anyone freaking out. But if I said, hey, I just grabbed this off the news this morning on my way here, and this was at San Francisco Airport, do you think any of us would be getting on a plane this evening? Even if we wanted to, we wouldn't be able to. The airports would close down. There'd have to be a massive inquiry. How do we get to this where 400 and, I've got the numbers here because I don't want to get them wrong, there's 416 seats in a 747. If one plane load of people die, would we be able to get on a plane? No, we wouldn't. And yet in healthcare, unfortunately, we kill a lot more people on a daily basis. In Australia, we basically kill the equivalent of 2 plane crashes every single month. And in the States, it's a lot worse. We're looking at 235 crashes in a year or 2 crashes every 3 days. And that's not because your healthcare system is any better or worse in Australia. You've got a lot more people here. So that, it's just the law of averages. And that is not good enough. And we need to keep reminding ourselves that this is the reason we do what we do. And it's not just people that we harm or kill. As we also hear at Medicine X, for unfortunately a lot of patient stories, and unfortunately I wish they were unique stories, and they're not, and the patients themselves know how bad that is. So we also have delays in getting research into practice. In one study, for instance, they showed that the drug that worked really well, it was published and everyone agreed, yeah, it works really well. It took 18 years before it was a commonly prescribed medication. We also know in a study done recently that 40%, yes, 40% of current medical practices were found to offer absolutely no benefits. They're either a waste of time and a waste of money, or we hurt people from them. And as we probably MedX, this question is probably a bit rhetorical here, but how many of us really do ask our healthcare professional when we're given advice, does it actually work? I know most people in my life don't. So let's have a quick fly through digital disruption. Anyone here would like to work for a company or maybe own a company that would experience 800% growth in one day? Yeah, okay, cool. For those of you in the audience there on Global Access, pretty much everyone agreed. Now this is Silicon Valley, so this is probably not unusual here, but it is unusual everywhere else. So this is the company, Uber. Uber got an 800% growth in one day. Why? Because London cab drivers don't really like Uber very much, and they protested, and they thought, I know what we're going to do. We're going to park our cars in the street, we're going to block up traffic, and everyone will know, and we'll get rid of Uber. And of course, what happened instead? Everyone's pretty annoyed that they're getting stuck in traffic, wanting to know why. Apparently there's some company called Uber no one's ever heard of. Well, what's that all about? Oh, they're a taxi service. Well, fine, I'm signing up to them right now, thank you very much. Because these guys have really annoyed me. And look at me, I'm trying very hard not to swear. So I said annoyed instead of the word I was going to say. It's an Australian thing, sorry about that. Anyway, so that's what happens though. So the 800% growth because people don't like digital disruption. London was at a standstill, but Uber is pretty cool for them. And Australia, I was surprised to get in. I've had a couple of Uber drivers in my visit here in San Francisco, and the cars have actually like a sticker label thing on their dashboard telling you that they're an Uber driver. You don't see that in Australia because they have to hide that they're an Uber driver. One of my Uber drivers in Melbourne had his tyres slashed. In France, I know they were burning, there was cars being burnt, because all around the world, people don't like digital disruption. It doesn't matter what industry you're in. I just wanted to give a shout out for this guy. He's a minister in New South Wales and he thinks Uber's a cool thing, and so does Airbnb. But what we're looking at when we talk about digital disruption is really around disintermediation, which is basically changing the value chain, simplifying it, and taking out the unnecessary parts. So this is the future. Whether we like it or not, in all sorts of industries, we're going to be disrupted. And a lot of this conference is looking at how do we disrupt our healthcare. And this is I thought this was a good quote, so it dates back to the late 1800s. All truth passes through 3 stages. First, it is ridiculed. Second, it is violently opposed. And third, it is accepted as being self-evident. And I just put that there so you can think about the sorts of changes that we're talking about in healthcare that we know we desperately need and we desperately want. Which phase are we at? And this is a more recent quote written by an economist in Australia. And he said, "Can this deluge of disruption be stopped or even delayed?" Short answer, no. Long answer, definitely not. Because we know that in healthcare especially, we are going to have to disrupt and change every single business model in healthcare. And that's the important thing. In a conference like this, I don't want to go into details about what are the opportunities for digital disruption. That's pretty much the entire content of this program. However, what's really important when we're talking about technology is to make sure that we don't focus purely on technological solutions to the challenges of healthcare, because that's not enough. If technology was all we needed to fix healthcare, it'd be done already. It's way more complicated than that. So what we need to do is making sure that for those of you who are technologists and are looking to disrupt healthcare, for your product and your company to be successful, you need to understand the business models of healthcare. We need to look at innovation in the way that we fund healthcare, in the business models. We need to focus on productivity, not just efficiency. And I just wanted to give you a quick example, and I'm firstly going to apologise because I'm going to talk about this for like a minute, and it's really important. So I've got a few slides in here that I'm hoping that you guys can use as reference point later and go and check out what OpenMRS is all about. But my friend Terry Hannon actually gave me some material, so I've put it up here, and thank you very much, Terry, for that. OpenMRS, if you haven't heard of it, is pretty much a global phenomenon now. And what it is effectively it's a community. They like to say that it's very much a community. A lot of it's run by volunteers. But it's an open source electronic health record. And it has huge penetration, and it's had huge results already. So there's a study here, and again, I'm flying it through, and I don't want to say that it's not important, it really is. But in Africa, using OpenMRS has actually had a massive impact on how they actually treat and manage people with AIDS, which we all know is a huge issue over there. Because we do know that if we want to manage something, we want to improve something, we need the data. We need to collect the data. And this is the sort of data that they collected in this when they rolled it out in Africa. Huge amounts of data being collected. We must remove ourselves from the unscientific, non-data driven personal recommendations for care. We do that all around the world in modern medicine. As I've said, 40% of what we advise patients to do doesn't work. And we can have a huge impact on people's lives as individuals, their social lives, and also on the economic stability of our countries. As I said, I've put these up here just as a reference point for you. But look at the penetration of OpenMRS. It is used all throughout the world, in Asia, not in Australia, which is strange, considering that's where I'm from. But it's used all around the place, and it's very much an American thing as well. So I encourage you to have a look at it. The Philippines, which isn't too far from where I live, has actually adopted OpenMRS as its national e-health record for the entire country. And that's just been since last year. So back to health informatics. And as I said, health informaticians, they're specialists at this intersection of healthcare and IT. And Don Berwick said quite a while ago now, information is not a necessary adjunct to care, it is care. And effective patient management requires effective management of patients' clinical data. And I see that Don Berwick is actually running for governor. So this is something I grabbed off the internet last night, and he's still talking about healthcare because Don's been all around the world and he knows what we need to do to organise healthcare. And what his point is that from what he's seen and his experiences, healthcare doesn't have to be as inefficient as it is. It doesn't have to be unsustainable. We just have to organise it properly because we don't learn our lessons in healthcare. We keep repeating the same mistakes. So there's 3 points that we're looking at in health informatics at the moment. One, as I've talked about, designing, building and implementing new technologies that have good informatics foundations. Because if they've got good informatics foundations, they're going to be way more successful. But we also need to make sure, as most of you would know as well, that when you implement technology in healthcare, it's often not the technology that's an issue, it's the change management. So really investing in a workforce that actually understands, healthcare professionals understand what it is you do, why it's important. And similar, Nick said there's a certification for e-patients. Well, Australia has just launched a certification in health informatics. We launched it just before Christmas last year, and I'm really pleased to say it's been way more successful than we ever thought in its first year. So we've had over 100 people sign up, and most of them are doctors. They're paying money, $400 out of their own money, to sit a really, really hard exam that's actually got 104 multi-choice questions. We've had quite a few people fail it. It is challenging, but they've paid their own money to do it because they see it's an important thing. Because to be a clinician, it doesn't matter whether you're a doctor, an occupational therapist, physio. If you're a clinician in this day and age, and especially looking into the future, you can't do your job unless you know how to manage the information of healthcare and why it's important. And I'll just leave you with a quote again from my friend Terry. Terry says that physicians have this false belief that they are practicing effective clinical medicine. They're not. They don't have the right tools to do it. And until we get them the right tools, we're going to continue to have a costly and inefficient healthcare system. Patients are, of course, vital to this, and they're already being involved and taking over the management of their own health. And as a health informatician, I certainly want to encourage them to continue to do so and do what I can to facilitate that. So thanks very much for your time today, guys, and enjoy the rest of MedX. Thank you.